Hello everybody, welcome back. So we're going to talk about Module 4 and developing a recovery plan. The recovery plan, as you'll remember, comes in the context of having set up the recovery coordinating group, having assessed the impacts and the needs, and now it's about identifying some activities through which you're going to pursue recovery. And so what David and I are going to talk about in these next 10-15 minutes is how do you identify those recovery activities, and what does that plan might look like. Before then, we're going to talk a little bit about some of the sort of more theoretical issues around recovery. So just as a reminder, the number 4.2 at the top of the screen tells you the clause within the international standard that you can find out more information about identifying recovery activities. So clause 4.2, you can go to the ISO and find that out. So that's ISO 22393, and you can find out more information there. So in developing a recovery plan, for each action area, you can think about it as a transactional activity or as a transformational initiative. And here we're talking about those transactional activities that RCG will begin to think through. And here is about initially setting out some of the boundaries, some of the parameters of what that transactional activity can actually involve. So of course, it needs to fit within whatever resources you have available. So you need to understand what those resources are before you start planning activity. It needs to reflect on what the learning is from the response, so that you involve and include all of the different perspectives in what these transactional activities are. It can obviously seek to improve current conditions, seek to develop and restore essential services, support people who have been affected. It might be that you're starting to think about criminal investigation and any public inquiry, and so these transactional activities can start to support that process. Or it might be about reinstating preparedness for the future and for the next emergency that will emerge. And very much what David talked to us about in one of the previous modules was about that need to reinstate preparedness through recovery and through recovery plans. But before we start talking about what those plans might include, David's going to talk a little bit about how we prioritise those.
It's a suggested list that you could apply to. I think it's not exhaustive, but I think it's a good starter for 10. So, you know, it should always be about what's the benefit of doing this collectively together as a partnership. The clearest one should be an identifiable benefit to vulnerable communities, affected communities by the emergency itself. Other demographic groups, communities and sectors, of course, that may also have been affected either by the emergency or indeed the actions taken to address the emergency in the first place. And the benefits to the recovery of those important impacts and needs from the previous model, if you remember, we talked about identifying exactly what the impact of the disaster had been. And then enabling some of the beneficial outcomes towards renewal, thinking further ahead around transformational initiatives that make life better next time, or indeed, again, being ready for the next big major disruptive event. And of course, as with everything in public sector life, also it has to come within the parameters of available funding and the available resources that Duncan alluded to in the previous slide.
And so then you can start dropping into, well, what recovery activities might we actually want to implement? What are we going to keep about what we've changed, and what are we going to discard about what we've had to do differently as a result of this emergency, this crisis that we've experienced? So what this graphic does is it talks about the need to first start by reflecting and learning. So taking time to pause. And David, we found this absolutely crucial, haven't we, in terms of don't run straight from response into recovery.
Absolutely. Just taking that little bit of time out to, you know, have a conversation, a joint conversation about what it is that we need to do, what is the situation that we've just experienced, is a great way of starting to shape how you might begin to put things back together again.
We've been using the words of giving our staff the time for healing, just for reflecting on their own personal circumstances, as well as where their organisation, their job is, where their career might be headed, given all the experience that they've had of this emergency. So really the time to reflect and learn might take a few days, but more likely it's going to take a few weeks or maybe even a few months. That gives you time to plan. So if some people are doing that reflection, then that gives you time to plan and gives you time to take stock as to where your organisation is up to. And so it's not about running from response into recovery at the same pace. It's about acknowledging that a different pace is needed. And you can start by reviewing preparedness. So looking as to where are you and getting ready for the next emergency, and starting to think about what have we had to change about the way in which we deliver services, and which of those changes might we want to reverse, and we might want to reinstate previous operations that we've had to stop because of the crisis. How have we done things differently, and how might we want to renovate so that we continue to do things differently? What might we want to return to a pre-crisis state? So things that we used to do that we've had to stop, how are we going to return to those previous states? And what do we want to retain? So what are we going to keep that we're doing differently now? For example, during COVID was home working. How are we going to retain the good aspects of home working? And then starting to think through these in recovery mode, and also identify options or different renewal initiatives that might be able to give us different ways of thinking about what the future looks like. So this is just one way in which you can start identifying different recovery activities, but there are other ways, and I'm not going to go through this in great detail, but you can reflect and learn, review preparedness, reinstate operations, going across the top of this diagram in the way that I've just described. But here, thinking about it in terms of, well, what actions affect people, what affect the places in which we live and work and enjoy, and what are the processes that we want to change, and thinking through actions in quite a different way to the previous slide. We can't tell you how to think through what are the actions, because it's going to be different for different individuals, for different organizations, depending on where you are. But again, here's another way of thinking about what might these actions include. I think we went through this diagram in one of the earlier modules, but here it was about identifying, well, where have communities been affected? Where have the economy, the infrastructure, environment, health, governance, where have these all been affected? And what might we want to reinstate or retain, or about how we do things differently? David, let me hand over.
Yeah, very, very much what we wanted to do within the ISO and within this module is then walk you through how you might organise, structure the delivery of the activities that you agree as a partnership are essential, or you want to prioritise. And if you remember, this is in the context of you having already established a recovery coordinating group. So it begins to help that group to look at its structures, its delivery plan, and some of the governance. So very much the first thing we think you would do is agree recovery activities and the governance structures required to make sure they get delivered. So, you know, what's the purpose, what's the scope, what are the areas of responsibility for the partnership together or individual members of that partnership? Set the recovery strategies that we shared with you earlier on. Again, agreed some common shared aims and objectives. You know, sit down and actually agree what it is you want to achieve through the recovery process itself, and then agree what activities will be required, what tactical activities, I guess, in order to deliver those strategic aims and outcomes. And then talk about what we call project delivery. So program management, project management, you know, whatever governance structure is appropriate for the way you work normally to ensure that people do what they commit to do through this process. And then, of course, the final thing, which we'll come back to in a later module, then we'll talk about recommending initiatives that could be transformational and may help renew indeed beyond the disaster. So let's talk a little bit in more detail then about what outcome related objectives might look like. We believe they're hierarchical. We believe there could be any number, but we suggest here 7 that capture the essence of most disasters in our experience globally. So We always think it's most important to immediately assure preparedness, because let's be right, you don't know when the next disaster is coming. It could indeed be tomorrow. It could be concurrent, or it could be a re-emergence of the original disaster that got you working together as a partnership in the first place. So normally we would describe preparedness as being, can you continue to deliver your statutory duties, your responsibilities as an organisation and collectively as a partnership? Have you learned lessons, and are you ready for the next event? Restore operations to that acceptable state. It doesn't have to be the state they were in before. It has to be, a state to be able to cope with people's immediate needs in the aftermath. Address those impacts, the emerging impacts and needs that we've discussed in previous modules, all the way through to thinking about how you communicate about recovery, engage and communicate with some key stakeholders and the community itself, of course. And also, we think really importantly, just take a little bit of time to think about how you're going to remember this event, how you're going to celebrate the effort of people, but indeed recognise that many people have lost through the impacts of the emergency. A very important step towards building longer term resilience, which again is a theme we'll come back to. And then in the end as well, we'll go into these in detail next, an exit strategy that allows you to understand whether you've achieved everything you set out to do and that things are now truly safe to go back into business as usual. So these next slides, we're just going to break down each of those 7 objectives in a little bit more detail. I'm not going to spend a lot of time on them, and Duncan, maybe we'll just flip and flop between the two of us to keep the pace going. So to repeat, how to assure preparedness. Well, restoring all of your statutory duties we've already agreed is important. Managing those concurrent responses and recovery, or indeed beginning to address some of the secondary or knock-on impacts or sector resilience challenges that are emerging. Assuring readiness for the next emergency, whatever your local risk is, of course. Are you ready for the next event that is most likely to happen in the nearest future? And then debriefing and learning those lessons. That bit about taking a pause to ask each other, how might we have done better? What did we learn? What did we take away from this?
Number 2 on the slides about restoring operations, thinking about what have been the social, the health, the economic effects, how have environment, infrastructure been affected, and then taking an assessment of those, what have been the impacts on those, or on that table of 6, the 6 effects that we talked about a bit earlier. But thinking about what does an acceptable state actually mean? So, and then how are we going to restore? So starting to put together some clear ideas as to where have these impacts, needs emerged, and how can we take advantage of some of the resources that we've got to start to restore operations to an acceptable level.
And then addressing those emerging impacts and needs. So based on or refined by impact assessments, particularly important on a prolonged event, such as COVID, for example. The initial assessment of impacts changed very significantly throughout the 2 years of the current COVID experience that we're having. So refining impacts assessments equally important. But then, as Duncan's really just said, determining where that wider coordination or cooperation across partner or responding agencies or local authorities can add a bit of value. So it's not just doing things for the sake of doing it, it's working out where you can make a difference by coming together and collectively managing those needs and those impacts. And then where individual action is appropriate in each individual organisation, maybe managing that through business as usual methodology is slightly more effective. But constantly monitoring, assuring, measuring and completing, you need to understand what success will look like if you address these impacts and needs, and indeed being able to understand how you will know that success has been achieved. And then communicating, Duncan.
Yeah, so just communicating for recovery. We've seen it time and again, the importance of communication, both inside organisations and then outside to members of the public. But in order to communicate, you need to have good information, good situational awareness. Multi-agency information management is important, so that you know that you're presenting and providing and communicating an up-to-date picture as to what's actually happening. You need to consult with different communities to understand how they are experiencing the current situations, how they are wanting to experience recovery and renewal. And so that's about bringing information into the partnership about what affected communities actually think and feel, and how you can take that into account in a manner of co-production. It's about engaging with elected members, so engaging with officials that might not normally be in those conversations, and finding out what their priorities are within their democratic structures, and starting to make recommendations around regeneration, around economic and social development. And as David said previously, it's about communicating about how are you going to commemorate, how are you going to thank people for their significant effort, as well as remembering and recognising the loss that people have experienced during and as a result of the event.
I would maybe just like to say a little bit more about how you can approach the recommendation of regeneration opportunities, of what we've been calling renewal, those transformational activities. So, we recognise that most emergencies will require the bringing together of broader strategic partnerships beyond the immediate emergency responders, for example, or the resilience partnership, if that's an appropriate term for you locally. And we think there are a number of ways in which you can bring together a broader group of people to start discussing what those regeneration or renewal activities initiatives might look like. One of the ones in the summit, in the ISO, for example, we've recommended is something called a renewal summit. Again, because it gives people the chance to come together, to pause, to think, share their experiences, but more importantly, it gives them the opportunity to work together collectively to start discussing where life might be improved going forward. But identification of growth, sustainability, regeneration, development opportunities that arise, in this case from COVID, for example, but would be applicable in any flood event or severe weather event, or indeed following a man-made disaster. There are always going to be opportunities that can be exploited afterwards, and that's very much the focus of what we call renewal. And again, they can be environmental, economic, as Duncan said previously, even legal, societal, etc., etc. One of the most important things I think that emerged certainly through COVID, and I think globally, not just here in the UK, is that increased need to understand inequalities, inequities, those people who are always disproportionately impacted or vulnerable to disasters, is a fantastic opportunity going forward for regeneration and renewal.
And commemoration, as David said at the beginning, was incredibly important. Thinking about how can we commemorate, and as it says in the slide, that it's almost the process of determining what is appropriate commemoration for all is just as important, if not more important, than the act of commemoration itself. Very often commemoration gets delayed slightly because perhaps there's too much pain, perhaps there needs to be more discussion and more community involvement in that process of determining what commemoration is appropriate. And so we've seen in other places that it can take years for that process to happen, but the collaboration is absolutely central and important. Without it, you could end up going down an incorrect direction. It's understanding the place of co-production in memorialization and commemoration is going into communities and understanding what have they, or how have they experienced emergency, and then starting to think, what would they want to do? How do they want to see their efforts, their loved ones memorialized? And so it's something that it's very easy to get memorialization or commemoration wrong, and it's very difficult to do it well, which is why we're suggesting that co-production is so central.
And then finally, to be clear, it's always important to have an understanding of when this can stop and how you might determine that the time is right, indeed, to stand down the structures you put in place, the recovery coordination group, these activities that we previously discussed. And we wanted to suggest a number of criteria that we think are vitally important in making that determination. Some of them are quite obvious, but in our experience, they're not always well applied. So, for example, if you set some strategic recovery objectives, it seems sensible to ask the question, have you achieved them? Have you achieved them to the degree that you would wish to, Or indeed, can those actions now be delivered as part of business as usual? So, transition between the kind of more emergent state into something that could be managed in the normal governance sense. In COVID, for example, very much, are there any more outbreaks? Can they be managed by the local health and social care systems, or do they need the assistance of other organisations to come back together again to help them? Is always a good criteria. Have you actually learned lessons? Have you taken the steps to actually understand how you might do things differently in the future? And if you have done, have you begun at least to apply or describe a system by which you may know that you'll apply those lessons in future events? And then the final one, often overlooked but quite important, is there any remaining requirement for you to support public inquiry into the events itself? And are they being met by the local resilience forum here, or your local partnership for dealing with disasters and emergencies wherever you are in the world?
So just to bring things together, this module has been about developing the recovery plan. We've given you some ideas of what that plan could include. We're not trying to be too prescriptive in terms of the themes or the topics that it covers, because that will be very much determined by your partnership. But starting to think about how could you structure a document, or how could you structure a plan around some of those things. Some of the questions that we've been posing to recovery coordination groups are around the recovery plan in this blue box down in the bottom right-hand corner, is thinking about some statutory partnerships responsibilities for recovery. And so what are those responsibilities? And thinking about the scope, the objectives and the exit strategy for recovery, and thinking about what are the opportunities for co-production, recognising that in recovery, we said previously that you take a different pace in recovery than in response, a bit of a slower pace. And that means that you can start involving society in a bit more closely, and so starting to think through that. David, we haven't seen, or we've seen some places write recovery plans, but other places not write formal plans.
No, I think the kind of flexibility, the agility for partners to manage the process in the way that suits them best is clearly always going to be preferable. It doesn't need to have a prescriptive plan. I think it's more about having the right people around the table agreeing the priorities together. And I think it is important, of course, to have the impact assessment we already discussed, and you will need to document that process clearly. But actually writing a recovery plan, or just having a good governance structure in place to understand that activities are being pursued, that objectives are being achieved and met, and that there's a process for signing off on that, I think is the most important thing.
Yeah, and individual organisations are doing what they need to recover their own operations, and then reporting that into the partnership to say, yeah, we're ready for the next emergency, we're prepared. Absolutely. So before we finish there, I just wanted to reiterate that in these modules, we're not trying to get them word perfect. We're not trying to over design and over engineer the conversation that we're having. So when I will listen back to this, I'm sure there are changes that David and I would want to make, but we're hoping that the conversation that you're hearing is nevertheless helpful and interesting and provoking. So thank you for listening, and we'll see you in module 5.